Hi, I'm Jennifer Betts. I'm a blog writer here at Ohio Marijuana Card, and I'm here today talking with Dr. Elizabeth Klenk. She is an internal medicine doctor who has a specialty training in oncology. Hi, Dr. Klenk. Thank you so much for taking the time to talk to us today.
Nice to meet you, and it's my pleasure.
Thank you. It's nice meeting you too. Let's just get right into it. The first question I have for you is what kinds of symptoms are related to cancer or cancer treatments that medical marijuana can help ease?
Cancer is such a diverse disease, and unfortunately, it manifests itself in many ways. There's generally two major ways that I tend to think about things. And I look at the THC and the CBD that we find in medical cannabis. And the THC itself helps to reduce inflammation, and that may help to decrease or relieve the pain, the joint, the muscle aches, and the stiffness that's associated with the cancer itself. The chemotherapy and radiation therapy and even surgery that happens with cancer can cause perpetual feelings of nausea. This also can affect appetite. This can cause malnutrition for people, eventually leading to cachexia, which is a very, very severe form of malnutrition. We as doctors try to prevent that from happening because we want people to be as bolstered as possible to fight a very terrible disease. And the THC may be able to help relieve nausea as well. And finally, THC will potentially help protect a patient and relieve neuropathic pain, which can be associated with the chemotherapy agents or can be associated with tumor growth.
And to be clear, we're not suggesting that people actually use medical marijuana to treat cancer itself, correct? Medical marijuana is not a cure for cancer.
Correct. And then in follow-up to that other question, CBD is the other compound that we find. And CBD is something that we see as a different use because of the effect that it has on things like anxiety and stress. It can help improve insomnia, and these are not, things that the THC affects as much. It can also help with things like seizures. We know that scientifically, that is one of the things that we have been able to do research on. And the reason that's important is because a lot of cancers either start in or can metastasize to the central nervous system. And so possibly by using CBD, we can decrease the possibility of seizures for patients.
Okay, so now CBD is something that people can just buy at their local Circle K, right? So what's the difference between the CBD that you can buy at Circle K and the CBD you can buy like at a dispensary?
We have a totally different availability of active compound in the medical grade CBD versus something that you can buy over the counter. And if you were to try to compare things, it would be like buying something like Tylenol over the counter versus getting something like a prescription non-narcotic pain relief from your doctor. That is going to be a lot more potent and a lot more concentrated. You also are looking at something that is more strictly monitored, and you're going to get a more pure compound.
Got it. Okay. And is medical marijuana, THC, CBD, are these compounds safe to include and incorporate into your treatment plan that may have more traditional medicines as well?
It is something that a majority of oncologists feel has a good place. Mm-hmm. There was actually a study done that was presented in 2019 at the American Society for Clinical Oncology National Meeting. And in that study, they showed that 73% of the medical professionals that were surveyed felt that there was a place for this, but only 46% felt comfortable recommending this. There is a lot of importance that has to be placed on the patient to discuss this with their oncologists, whether it's their surgical oncologist, their radiation oncologist, or their medical oncologist. And, we all think about the chemo doc, that's the oncologist. Well, definitely there's the radiation doctor, there's the surgeon. We, as oncologists, the easy place to say there's a place for this is for relief of anxiety and for help with pain control. I've seen patients be able to reduce the amount of prescription controlled substances, benzodiazepines like Xanax and Ativan, pain medications like Percocet, hydrocodone, and get more in control of their whole treatment program in that regard. Because in cancer, everything's out of a patient's control. You don't know what's going on in your body, and it's a lot of treatment to treatment, and then finally you're done with treatment, let's see where you're at. Now, of course, there's that whole other side of these things have to be broken down in your liver. And much like your chemotherapy is broken down in your liver, and about 60% of all medications get broken down in your liver, this is why it's really important to talk to your doctors about whether you are using medical marijuana for any sort of relief. It's potentially going to interfere with surgical anesthesia, for instance, with antibiotics, with anticoagulation or things that keep your blood from clotting. So in the overall medical condition of cancer patients, it's a very complex thing. And we can't just look at the cancer itself. We have to look at the patient and other medical conditions that could potentially happen. So there's, we have to make sure that patients are aware there's some bad things that could happen if they don't tell their doctor and they're put on certain medications.
There are a lot of moving parts involved.
Absolutely.
It sounds like one of the major benefits of medical marijuana is just for a patient to feel like they have a little bit of control over their treatment.
Yes.
Okay. And will patients with more severe symptoms, will they need to take products with stronger concentrations of THC?
This is one of those very unsatisfying answers. Maybe or maybe not. Everybody's different. We all have an endocannabinoid system, and this is the system in which the THC, the CBD, and the terpenes that are found in cannabis interact. We don't all have the same endocannabinoid system though. And because we are all different, just like some people take Tylenol or ibuprofen or Aleve for headaches, and we don't all take the same medicine, we could all take the same medical cannabinoid product and have a different reaction to it. Ultimately, all these different factors within a strain will affect different people differently because they interact within a unique endocannabinoid system.
Okay. And so getting to the right place, the right balance with your particular product, that is going to require a little bit of experimentation. Absolutely. I assume. Okay.
The way I like to look at it, and I explain this a lot to my new patients, is we as doctors put you into a particular classification, and that classification is like a target. Mm-hmm. And that target for this could be nausea or pain relief or helping with insomnia. And all of these things are put into a target. We then start to move you from this target into the bullseye range, and this micromanagement to get you to the bullseye range and keep you there. Mm-hmm. And that bullseye is potentially a floating bullseye, and we have to continually address this. Becomes a challenge and also very rewarding once we find that patients are an active part of their treatment, and they give us the feedback so that we can help micromanage things and move things in a better direction for them.
Absolutely. Oh, that's such a great analogy that really kind of clarifies your position in the whole management process. How does the impairment that somebody might experience from using medical marijuana compare to the other side effects that are commonly experienced in drugs that are used to treat similar symptoms?
It is possible that a person can experience drowsiness, confusion, change in blood pressure, dry mouth, balance issues, and a decrease in reaction time. But this is also common with Percocet, Vicodin, Ambien, Lunesta, Xanax, Ativan, the common things that we think of a lot of patients using during this particular type of treatment. So again, that unsatisfying answer of maybe, maybe not is always there. And it's important that a patient really start low, go slow, and see how a particular strain or treatment affects them.
So it sounds like when it comes down to it, it's a matter of preference, whether you feel like the side effects from, other traditional kind of painkillers or, whatever you might be taking are preferable to the side effects that you might experience from medical marijuana.
Absolutely.
Yeah. And is there a particular format or a specific type of product that seems to work best for treatments?
It's possible, and these are all generalizations, because everybody has different experiences. The topicals, creams, lotions, patches may improve pain control for neuropathic pain or muscle and joint discomfort. Vaping may help, or tincture may help with nausea, because you don't actually have to swallow something to keep it down. And we're thinking capsules or edibles. If you're already feeling sick to your stomach, trying to swallow and keep something down may not be as viable. An edible may help longer with insomnia because, again, you're slower onset, but it's going to last a little bit longer time. So a small amount of experimentation on a patient's part. Combinations of things may work better for them. And so the generalizations can be made, and a dispensary technician and the pharmacists at the dispensary are more able to micromanage and help with those things.
Help zero in on that target.
Yes, ma'am.
And so what kinds of changes have you seen in patients who start using medical marijuana to treat their symptoms related to cancer and cancer treatments?
The control factor starts to have a place in their lives, and not just in the doctor's life or in the treatment room.
Yeah.
They start to become a little bit more confident in things, and their quality of life starts to improve. In general, when you're feeling sick to your stomach, or you're not sleeping, or you've lost weight, and when quality of life is affected, and we're thinking of people who are questioning how much time they may have.
Sure.
Even with good treatment, people say, well, 90% chance that I'm going to get through this in 5 years, but there's still that 10% chance.
Yeah.
They want to make the most of their time that they do know that they have, and this gives them the opportunity to do so. I think that it's a very potentially beneficial aspect to treatment for people.
Yeah. So even just feeling like you have some semblance of control of your treatment plan, that can do wonders for the results that you get, I imagine.
Absolutely. When people are feeling like things are out of control, one of the terms that I've heard many times is failure. I'm failing my treatment. I or I'm failing to thrive. And that's such a negative term. When you start to put that positivity back in someone's life, they actually start to take those unexpected twists and turns, and it's not such a big, sharp change for them. They don't have as much downtime. They don't have as much mental aspect playing into this, and they're able to make better mental ground, which helps to get them into a better physical place. The mind and body are very, very strongly connected. And so any aspect of improving their treatment is a good thing.
Yeah, wonderful. And Dr. Klenk, I just have one more question for you, and I appreciate you taking the time to share your expertise with us today. Do you have any advice for patients who might be considering medical marijuana but are nervous to give it a try or hesitant about talking to a doctor about it?
The first thing is do some research. Knowledge is power. You might look into this and decide that CBD is something that you're interested in, and medical grade CBD being something that is a lot more dependable and different from what you can get over the counter. There's no psychoactive effect to it. You're not going to get high off of it. If that's at least a starting point for you and you feel comfortable, it may make a difference in your life. There's no study that's ever been done, and there's been tons of studies done that proves that marijuana can be addictive, habit forming, or bad in that regard. So, remember, this is something that we're looking at as a benefit, as an additive aspect to your treatment. Talk to your oncologist, talk to your primary care doctor, get their opinion on things. As I said, there's a number of doctors out there who feel that this is an important part of cancer treatment. They're just afraid to speak up, or they don't feel comfortable recommending it to their patients. If you do start medical cannabis, start with small amounts, slowly increase to find your ideal amount. Stay well hydrated. That is always important through treatment and through use of medical cannabis.
It's for everybody.
For sure. And don't mix medical cannabis and alcohol, especially if you're going through chemo. The chemicals just don't go well together.
Sure. Well, thank you again so much for your time, Dr. Klenk. Everybody, thank you for watching. We've been talking to Dr. Elizabeth Klenk with Ohio Marijuana Card. And if you are considering using medical marijuana to treat your symptoms related to cancer, cancer treatments, or any of the other qualifying conditions, visit our website at www.ohiomarijuanacard.com. There you can find our blog with lots of up-to-date information, or you can schedule an appointment to talk to one of our doctors. Thanks again, and have a great day, everyone.